Workers' participation is essential to achieve control of working hazards, and this is most successful when it comprises organised and represented workers bringing their informed point of view and their hands-on knowledge of the work, its risks, possible solutions, and what hurts, exhausts and sickens those doing the job to the table through their independent and autonomous representative. However, more and more workers are not represented or organised. Micro and small enterprises, or MSEs, account for nearly 99% of enterprises in the European Union and employ nearly 50% of EU workers.
The fragmentation, the new economy, means we have more workplaces, more small firms, and they are more vulnerable. On the average, they lack resources and competences to promote good health and safety. And this goes for both owners and, of course, for the workers. And workers in small firms are even worse exposed to precarious work, working temporary, working 0-hour contracts, and so on, which means that small firms are quite vulnerable. And the result is, on the average, a poor health and safety management, which means clearly had higher accident risks. But not only accidents, because we all know that accidents is only the top of the iceberg. Health issues kill 30 to 50 times as many workers as accidents do. And this goes also for small firms. And so the standard form of the prevention in small firms is workers have to take care of themselves, which rarely works.
And that's why smaller firms are really important to pay attention to, because often if you take a construction firm, you're more likely to have an accident or be killed at work if you're working for a small company than if you're working for a larger company. And I think that needs to be brought to the attention of politicians, that sometimes there's this belief that small firms are safer than big firms. That's not true. And often there's also this second belief, well, if you're working in a small firm, it's more like a family. And because it's more like a family, well, then you're more likely to take care of your workers. Not always true. Sometimes true, but not always true. So it's really important that politicians are aware of the need to inspect small firms, and they're aware of the need to help small firms to be able to understand what the risks are and to put in place the proper prevention mechanisms.
So what can be done? In such situations, the conventional means of protecting workers' safety and health, whether through regulatory enforcement or through advice and support from prevention services and the like, fail to reach the great majority of these workers in MSEs.
And the basic result is there's only one form which helps: visit programs. Go to the small firms to talk with managers and workers, and what are the risks, what can you do, how can you improve.
One such union response to this challenge are trade union prevention agents, TUPAs. That is, people designated by trade unions to intervene in MSEs from outside to support the workers and managers to reduce risks at work.
They reshift the focus, the employer's duty of upstream prevention. Secondly, they talk to workers and bring their experience into the dialogue with employers. And thirdly, they, everywhere where it's possible, they try to improve the local dialogue.
We have examples. In Sweden, since the 1970s, trade unions have had the legal right to appoint regional safety representatives, or RSRs, who have the power to act in all companies in their field which do not have a joint committee on OSH. Normally, such committees must be set up in all companies with a stable workforce of more than 50 people. Have a union member among their workforce.
And the largest system, it covers roughly 2/3 of all the small workplaces with employees. In 1974, when it was introduced, it was actively promoted by the employers, who said, yes, we need local cooperation. But unfortunately, we can't have local safety reps who are trained enough and independent enough. So yes, regional safety reps is a good idea.
At present, there are around 1,700 part-time RSRs who also take on other tasks. Some are safety representatives within large companies. Others are trade unionists who combine their work as RSRs with other trade union tasks. It is estimated that, in total, RSRs in Sweden make up the equivalent of 311 full-time posts. The cost of the system is about 20 million euros. This is partly borne by the government, but nearly half is paid for by the unions themselves.
Shortly say they are by far the most important health and safety promoter in small firms in Sweden. Labor inspector visits at best 5,000. I think more like 2,000-3,000 small firms per year. And they visit 50 to 60,000.
During each visit, they review documentation, inspect workplaces, and monitor working conditions, adapting their focus to the risks inherent to the sector in which they operate. In addition, they talk to workers and to local safety representatives where they exist, and try to discuss the problems they have identified and their improvement proposals with managers. The union's annual detailed reports demonstrate that the RSRs are effective in reducing risks and promoting both local safety representatives and better management of the work environment. In spite of some conflicts, RSRs described having generally reasonable cooperation with employers. Nearly all were positive, 55%, or neutral, 43%, at the RSR's first visits, and the relationships generally improved over time. Around a quarter of RSR visits were even initiated by employers. RSR's suggestions for improvement were also mainly received positively, 56%, or neutrally, 37%, by employers. There are two different types of health and safety representative relevant to the needs of workers in MSEs in Italy.
Italy has territorial representatives by law, but the operations of these territorials are by law to be agreed with the employer.
The OSH representative at productive site level, or RLSSP, representing the OSH interests of workers on multi-employer work sites. In 2008, this RLSSP role was institutionalized in the context of ports, construction sites, and complex production sites, characterized by a high-density workforce and the presence of many companies.
Especially in north of Italy, but also in Rome, there are several good agreements with employers setting up operational territorial safety reps, achieving a lot of results, of course having problems, of course having conflicts sometimes, but the Italian chapter, the Italian report documents masses of successes, masses of support, of cooperation with small firm owners, and talks to workers and empowering workers and improvement in health and safety.
However, the bilateral joint bodies operate in very different ways in different regions, and common strategies are underdeveloped at the national level. Also, in terms of the role of the RLST, there are still significant problems of coverage in many territorial and sectoral contexts, characterized by a structural and procedural fragmentation and fissure among these firms and the economic contexts in which they are situated. The most effective experiences based on cooperation are those promoted by the most structured bilateral bodies. And in these cases, there appear to be several determinants of such effectiveness. These include an adequate number of TUPAs, which is also dependent on a high presence of affiliate companies and a significant level of economic investment. the development of locally planned interventions involving strategies shared by the social partners and institutions, projects promoted by the unions focused on specific issues, the continuous presence of the TUPAs in the territory, as well as the establishment of local offices and the involvement of TUPAs in training courses for workers, and the provision of both appropriate tools, including IT, and training to support TUPAs. This said, the findings also show that TUPAs are able to turn to more conflict-based strategies aimed at mobilizing collective actions to support the protection of workers when they are faced with serious abuses by employers. In spite of the absence of a legal provision, there have been several instances of TUPAs in Spain. All of them consist of health and safety experts visiting small firms.
Spanish unions 25 years ago were fighting to introducing regulation on regional reps, territorial reps in the law, but they failed in that. But they did succeed in getting political and employer support for several regional agreements and some sectorial agreements. So they have it in covering something by 45, around half of the workforce are covered by various systems. And as these are by agreements, the agreements in general workers in Madrid is quite different from the agreement on construction workers in Asturias.
One of the peculiarities of the Spanish experiences is that these agreements have had to take into account the appointment not only by trade unions, genuine TUPAs, but also by employers' associations of external experts who interact with small firms' health and safety management systems. These preventive agents act jointly or separately, depending on the agreement in place. There are even cases when visiting teams include an expert from the regional administration.
I can mention two very positive cases. The construction agreements in Asturias has been history, I think, something like 20 years. And they used to operate one representative from employers and the unions together for many years, which helped. Since 4 years, they are to cover more workplaces. Employers go to some, unions go to some. But the union, TUPAs, or whatever you call them, trade union, preventive agent, still are effective. They still achieve a good local dialogue. Of course, they met sometimes with hostility, but not very often. Because even small firms, employer known there is an agreement, there is a backup, and problems are giving back to the joint committee. So all in all, the assessment is, yes, there are still risks at construction workplaces in Asturias, but they are much better than they were 20 years ago. And the same forestry, this means government, regional government ordered forestry in Castilla y León. It took a lot of union fighting, but now there is standard of giving these temporary forest working teams training and proper preventive methods and so on. So by union struggle, they too have succeeded quite well. And then UK had large-scale trials with roving safety reps and so on around 2000. And they too were successful. Even if there were union people coming as intruders to small firms, they managed to get good local dialogues and a lot of health safety improvements.
In the banking sector, for example, there are arrangements to allow trade union representatives access to work sites on a regional basis by voluntary agreement between the unions and the employers in the sector. On some large construction sites where the principal contractors are among the largest construction firms, full-time trade union health and safety conveners provide representation not only for workers employed by these principal contractors, but also by agreement with them for workers employed by other contractors and subcontractors. Such strategies for enhancing health and safety in small firms are also evident in sectors in which there are large numbers of workers in small enterprises. The Union of Shop Distributive and Allied Workers, USDAW, for example, has a well-developed system for representing its members in small workplaces through the appointment of organisers, many of whom are former workplace representatives, covering large numbers of different workplaces, usually within a particular region. Health and safety is a prominent issue for these union organisers, who provide advice and information, make representations to management, and may be involved in investigating hazards and accidents. According to 2018 TUC guidance on representing workers in micro and small companies, many unions have been successful in developing some form of roving safety representatives. Several unions have got employers to agree that health and safety representatives can inspect areas of work where contractors are working, raise issues with the contractors, and discuss safety matters with the contractor's staff. In the voluntary sector, unions have been able to negotiate that a safety representative covers a number of employers. Some local authorities have agreed that, in schools, there is a system of roving safety representatives whereby several representatives are given time off to visit other schools to inspect. In one ambulance service, management have supported a scheme where 12 roving health and safety representatives cover all the ambulance stations in the area. One branch got their employer to agree that health and safety representatives would be given time off to visit all locations, even those where there were no union members, and raise concerns. They have been able to recruit a significant number of them, and as a result, some of these workplaces now have union health and safety representatives. In conclusion, TUPAs are a potentially useful tool to improve OSH performance in MSEs because, as research evidence shows, face-to-face contact with change agents is by far the most effective way of bringing about a successful intervention. What are the key elements that make TUPAs schemes work? The unique competence, confidence and skills TUPAs have been shown to be able to develop and apply. The supports trade unions and bipartite bodies provide that help give them these attributes. Adequate and sustained funding. Proper allocation of training and means for TUPAs to develop their interventions in MSEs. A framework of institutional cooperation between trade unions, employers' organizations, regulatory agencies, and public authorities.
And the last thing, which is central, the selection of these people who are becoming various forms of TUPAs, regional territorial reps, is important. Because going out as an intruder to small firms is a very sensitive task. And nearly always they succeed because they have the right type of person, they have a lot of experience of interacting with manager, and they have the proper training in both the legal position and health and safety. But it's a challenging task.
Political will to adopt macro-level policies and strategies to support the extension and resourcing of schemes involving TUPAs is determinant of their wider application.
I think that every politician is aware that working people, their families, their communities aren't happy with a situation where workers go to work and where they don't come home because they're killed at work or they come home but they're made ill by their work. So nobody is satisfied with that. Some people aren't satisfied with it because of economic reasons, but working people aren't satisfied with it just from a human rights, a human dignity point of view.
Besides TUPAs, trade unions in the 4 countries studied have undertaken other kinds of action to support intervention processes on OSH in small firms, such as joint structures to support workers and employers with advice, information and training. Interventions higher up supply chains have also been employed by trade unions in sectors such as transport, textiles and construction, both nationally and globally, to influence the working conditions experienced by workers in the micro and small firms that are often situated at their ends. As barriers to the wider development of TUPAs schemes, we underline the following. Considerable resistance to the mainstream adoption of such approaches from employers and small business organizations and their political supporters in government. Regulators are wary of endorsing schemes without the support of the social partners. Unions are not in a position to invest resources and efforts in initiatives aimed at groups of workers among whom they have few members.
Wherever there is funding enough, and quantitative funding and continuous funding, and wherever there is enough cooperation with authorities and employers, they work, even despite they are coming from outside as union intruders. Is there any chance to extend this type of system to more small firm workers in the EU? This depends. What you need is for both politicians and employers to, not only in formal speeches, but in actual actions, support the need to go out and have a visit programs to small firms, and also to have a strong recognition and acceptance for the need for workers to be represented. And you need union resources. I think it's important to remember this is not only something that can work in Sweden, in the north of Europe. It does work in Italy, it does work in Spain, and when they tried it in Britain on a large scale, it worked as well there. So, more TUPAs to the workers of Europe.